Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Well, hello everyone, and welcome to this Monday morning. Another Monday, another week. Just to let you know, I'm still waiting for that surgeon to call me for my knee to find out, what they want to do. And I keep calling my doctor once a week, and I just got tired of it, so it probably won't happen until I see my doctor next month to make that decision if they're finally going to call somebody for me. But like I said, right now I am where I was a month, 2 months, 3 months ago. Still waiting, still in pain. Well, today's episode is going to be about diabetes, but it's going to be more referred to the 12 warning signs that appear on your skin if you have diabetes. And just to give you a disclaimer, once I post this, viewer discretion is advised. Some of the pictures can be kind of, gross, I guess you could say. But I just wanted to give you that heads up before I post them on the Facebook page. Alright, so let's just jump right on in here. Diabetes can affect many parts of your body, including your skin. When diabetes affects the skin, it's often a sign that your blood sugar levels are too high. This could mean that you have undiagnosed diabetes or pre-diabetes. Your treatment for diabetes needs to be adjusted. If you notice any of the following warning signs on your skin, it's time to talk to your doctor. The first one is yellowish, reddish, and brown patches on your skin. This skin condition often begins as small raised solid bumps that look like pimples. As it progresses, these bumps turn into patches of swollen and hard skin. The patches can be yellow, reddish, or brown. Now, you may also notice the surrounding skin as a shiny porcelain-like appearance. You can see blood vessels. The skin is itchy and painful. The skin disease goes through cycles where it is active, inactive, and then active again. This is the action you need to take. Get tested for diabetes if you have not been diagnosed. Work with your doctor to better control your diabetes, and see a dermatologist about this skin issue. Alright, number 2. Darker area of skin that feels like velvet. A dark patch or band of velvety skin on the back of your neck, armpit, groin, or elsewhere could mean that you have too much insulin in your blood. This is often a sign of pre-diabetes. It often causes darker skin in the creases of the neck and may be the first sign that someone has diabetes. And the action you need to take on this is get tested for diabetes. Alright, number 3. Hard, thickening skin. When this develops on the fingers, toes, and both, the medical term is called digital cirrhosis. On the hands, you'll notice tight, waxy skin on the back of your hands. The fingers can become stiff and difficult to move. If diabetes has been poorly controlled for years, it can feel like you have pebbles in your fingertips. Also, hard, thick, and swollen-looking skin can spread, appearing on your forearms and underarms. It can also develop on the upper back, shoulders, and neck. Sometimes the thickening skin spreads to your face, shoulders, and chest. In rare cases, you have skin over the knees, ankles, and elbows also thicken, making it difficult to straighten your leg, point your foot, or bend your arm. Whenever it appears, the thickened skin often has the texture of an orange peel. The skin problem usually develops in people who have complications due to diabetes or diabetes that is difficult to treat. The action you should take is tell your doctor about the thickening skin. Is it getting better under control, or your diabetes can bring relief? You may also need physical therapy. When the thickening skin develops on a finger, toe, or other area with joints, physical therapy can help you keep your ability to bend and strengthen the joint. Alright, let's talk about number 4, blisters. It's rare, but people with diabetes can see blisters suddenly appear on their skin. You may see a large blister, a group of blisters, or both. The blisters tend to form on the hands, feet, legs, and forearms, and look like blisters that appear after a serious burn. Unlike the blisters that develop after a burn, these blisters are not painful. Large blisters like this one can form on the skin of people who have diabetes. The action you need to take is tell your doctor about the blisters. You'll want to take steps to prevent an infection, and talk with your doctor about how to better control your diabetes. Number 5, skin infections. People who have diabetes tend to get skin infections. If you have a skin infection, you'll notice one or more of the following: hot, swollen skin that is painful, an itchy rash, and sometimes tiny blisters, dry, scaly skin, or white discharge that looks like cottage cheese. A skin infection can occur on any area of your body, including between your toes, around one or more of the nails, and on your scalp. The action you want to take is get immediate treatment for the infection. Tell your doctor if you have frequent skin infections. You could have undiagnosed diabetes, and if you've been diagnosed with diabetes, you may need better control of it. Number 6, open sores and wounds. Having high blood pressure for a long time can lead to poor circulation and nerve damage. You may have developed these if you've had uncontrolled or poorly controlled diabetes for a long time. Poor circulation and nerve damage can make it hard for your body to heal wounds. This is especially true on the feet. These open wounds are called diabetic ulcers. If you have diabetes, you should check your feet every day for sores and open wounds. The action you want to take is get immediate medical care for the open sore or wound, and work with your doctor to better control your diabetes. I've had an open sore, not on my foot, but one on my hand, I believe. And it took forever for that to heal. And I tried everything, Neosporin, everything you use, but it would not heal at all. It took like almost a month for it to do, so I had to be real careful. Not making the wound open up again, and those issues. So number 7, they're called Shin Spots. The skin condition causes spots and sometimes lines that create a barely noticeable depression in the skin. It's common in people who have diabetes. The medical name is diabetic dermatopathy. It usually forms on the skin. In rare cases, you'll see it on the arms, thighs, trunks, and other areas of the body. Shin spots. So with shin spots, many people mistake them for age spots. Unlike age spots, these spots and lines usually start to fade after 18 to 24 months. And you need to take action is tell your doctor about these spots, work with your doctor to better control your diabetes, and if you haven't been diagnosed with diabetes, get tested. Alright, number 8. Outbreak of small reddish yellow bumps. When these bumps appear, they often look like pimples. Unlike pimples, they soon develop the yellowish color. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or back of the knees. They can form anywhere though. These bumps appear suddenly and clear promptly when diabetes is well controlled. When these bumps appear, they often look like pimples, but unlike pimples, they soon develop a yellowish color. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or backs of your knees. They can form anywhere though. No matter where they form, they are usually tender and itchy. And the action that you want to take is tell your doctor about the bumps, because this skin condition appears when you have uncontrolled diabetes, and talk with your doctor about how to better control your diabetes. Number 9. Red or skin-colored raised bumps. Whether this skin condition is associated with diabetes is controversial. We know that most people who have granuloma do not have diabetes. Several studies, however, have found this skin condition in patients who have diabetes. One such study found that people with diabetes were most likely to have a granuloma over large areas of skin, and that bumps came and went. And another study concluded that people who have granuloma that comes and goes should be tested for diabetes. So if you have this would be considered the colors of red, pink, or bluish purple. And the take action you want to do is let your doctor know if you have bumps like those shown here, which I'll be posting, especially if the bumps come and go. Alright, number 10. Extremely dry, itchy skin. If you have diabetes, you're more likely to have dry skin. High blood sugar can cause this. If you have a skin infection or poor circulation, these could be contributed to dry, itchy skin. The action you need to take though is tell your doctor about your extremely dry skin. Getting better controlled diabetes can reduce the dryness. If you continue to have dry skin after you gain better control of your diabetes, a dermatologist can help. Alright, number 11. Yellowish, scaly patches on or around your eyelids. These develop when you have high fat levels in your blood. It can also be a sign that your diabetes is poorly controlled. The action you want to take is tell your doctor about the yellowish scaly patches around your eyes, and talk with your doctor about how to better control your diabetes. Controlling diabetes can clear the scaly patches. Alright, number 12. Skin tags. This is a big issue with me. I've got them everywhere. Many people have skin tags, skin growths that hang out from a stalk. While harmless, having numerous skin tags can be a sign that you have too much insulin in your blood, or type 2 diabetes, which I do have. These growths are most common on the eyelids, neck, armpit, and groin. The action you need to take is ask your doctor if you could get tested for diabetes. And if you have diabetes, ask your doctor if you need to get better control of it. Now there is another condition that I do want to add to this because it wasn't on the other website. So there was a couple other items I found on another website that I wanted to talk to you about also. It's called Bacterial Infection. High blood sugar can dry out your skin and curb your immune system. This raises the risk of skin infections, with staph being the most common. You might have styes on your eyes, inflamed hair follicles, or infected nails. Talk to your doctor if you have any of these if your skin feels swollen, itchy, painful, or hot, especially if you know you have high blood sugar or diabetes. Another one that I found was fungal infection. Fungi, like bacteria, love to hang out in moist folds of skins. That includes your armpits, under the breasts, around the nails, and the corners of your mouth. You may have heard it called athlete's foot on your feet, jock itch or on your genitals, or ringworm on your scalp. This is the most common causes of this fungus. Your doctor can help treat the infection and tell you if you have signs of uncontrolled diabetes. I'm glad I found all these other issues that you might have. Here's another one. This is around your eyes where it creates white bumps. It happens when your body collects extra cholesterol around your eyes. You might notice flat or slightly raised yellow growths on or around the eyelids. The deposits aren't harmful or painful, but they could signal uncontrolled diabetes, high blood pressure, or other health problems. Another item of concern would be foot ulcers. These sores can start with nothing more than a small scrape if you have diabetes, especially if it continues to rub in tight-fitting shoes. That's in part due to poor circulation that makes it harder for wounds to heal and also can cause nerve damage so you can't feel as well. Check your feet for sores every day and ask your doctor how to best treat them. And finally, I hope I'm pronouncing this correctly, vitiligo. It's more common if you have type 1 diabetes, but those with type 2 also can get it. It's not clear why. Vitiligo destroys cells that normally color your skin with pigment. You might notice patchy skin of a clearly different color. It usually affects your chest, belly, and back, but sometimes happens on the face as well. Vitiligo may be treated with medicated creams, UV light, and even surgery. Use sunscreen to protect the skin and patches if you're outside. Well, I hope that gave you guys a lot of information. I know I learned a lot this time around with this information I found on diabetes and the things that you need to look out for. But it's very important that you always examine your body as much as you can every day to make sure you don't find those little sores or little scrapes and things that aren't healing very good. And then contact your doctor most definitely. Now I am going to post those 2 websites that I found. Again, viewers warning, the pictures are kind of, can be kind of, don't look very good because of the things that they're having issues with, but they only show small parts of the body, so you don't have to worry about that. But I just wanted to give you a fair warning. But again, have a great week, have a great weekend, get out there and enjoy the weather wherever you live, and I will talk to you next Monday. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode plus others are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.